Hello, this is Tom Davis. I'm Global Sector Lead for Health and Nutrition for World Vision, and this is a presentation on nurturing care groups, the what and why. So we have made remarkable progress in reducing infant and child deaths in the past few decades. The annual rate of reduction in child deaths has increased from 1.9% in 1990, when 12.6 million children died every year, to only 4% today. This is God's promise coming to pass, and many of you were part of bringing about this part of God's kingdom through your work in promoting clean water, hand washing, and sanitation to reduce diarrhea and other waterborne diseases. But we still do have more work to do. Despite the global progress, an estimated 5.2 million children under 5 still died in 2019, and 1 million children 5 to 14 years of age died in 2017 alone. So why nurturing care groups? The Nurturing Care Group Core Project model is a multi-sectoral version of the highly effective care group approach. We designed this model to promote behaviors associated with most elements of the Nurturing Care Framework, which was released by WHO and UNICEF in 2019. The purpose of the model is to promote basic parenting skills and adoption of key behaviors from most sectors, not only WASH, but also health and nutrition, where care groups have traditionally been used, and also child protection and early child education, where it has been used less often, and possibly also caregiver mental health. The Nurturing Care Framework promotes many things which all of us have already been promoting through care groups, like good health and adequate nutrition in particular, but it brings in more of the Thrive agenda by focusing opportunities for early learning, security and safety, and responsive caregiving. You'll see that WASH fits into the good health part of that model. Note that with this model, we give the option for working with almost every child in every household in a community, such as households with children 0 to 18, as we did in Ghana, or a more targeted approach, such as households with pregnant women and children under 2. We also are adding more guidance to the training manual on how to work with faith leaders. With this project model, field offices can promote behaviors across all sectors except livelihoods. In fact, you could promote all of the behaviors included in the 74 WASH, health, nutrition, child protection, education, spiritual nurture of children, and mental health lessons in about 3 years. All field offices are encouraged to promote at least 4 lessons from each sector when using this model, but field offices have the freedom to choose the behaviors to promote that fit with their given context and TP. Field offices would not normally use all of the lessons in the full list of lessons in a given project, of course, but instead tailor their lists to a particular region or group of communities' needs based on baseline assessments. So this is what the model looks like. Let's start over here on the right. Each Nurturing Care Group volunteer shares lessons with 10 to 15 neighbor caregivers and their families, known as a neighbor group or neighbor circle. Now, these Nurturing Care Group volunteers are chosen by those 15 caregivers when you bring them together, and we'll talk about why that's important later on. Moving over a level, each Nurturing Care Group has 10 to 15 of these Nurturing Care Group volunteers that are elected by their neighbor group members. Each Nurturing Care Group promoter, paid staff, or community health workers support 4 to 9 Nurturing Care Groups. Each supervisor is responsible for about 4 to 6 Nurturing Care Group promoters, and in larger projects, you might have a coordinator who is responsible for like 3 to 6 supervisors. A project may hire multiple coordinators overseen by a manager if needed to meet the desired coverage. That would probably normally be done in a grant instead. So with this Nurturing Care Group, there's certain features of it that we'd like to point out. One is it fits with multiple World Vision strategic initiatives. It builds on World Vision's Global Impact Framework and helped World Vision to achieve 11 of its 15 well-being objectives, 6 strategic initiatives of our promise as well. It's multi-sectoral, plug and play, and flexible, as I said earlier. It's very low cost, and I'll give some details on that in a few minutes. The level of staffing needed is quite low. You can staff it through current AP staff and some Hay grade 6 to 10 Nurturing Care Group promoters, or by using local Ministry of Health or Ministry of Water staff like community health workers as the Nurturing Care Group promoters. It's highly cost effective. It has more than double the behavior change of many existing behavior change models, as I'll point out in a few minutes. You also get intensive beneficiary contact with it, about 20 to 26 contacts a year. One reason that we wanted to build a multi-sectoral model that we could be scaled in World Vision and used particularly in WASH is that we know that the care group approach lowers child deaths better than other behavior change approaches. In this 2015 study that I co-authored with Johns Hopkins researchers, we compared the effectiveness of multiple care group projects in 5 African and Asian countries to other USAID-funded child survival projects that did not use care groups. We looked at adoption of key child survival behaviors and the effect on the under 5 mortality rate. And this table shows the mean changes in adoption of behaviors of care group and non-care group projects. So for example, hand washing with soap rose 20 points on average in non-care group child survival projects, but 43 points in care group projects. We compared 10 care groups and 9 non-care group projects, which were matched by country and year of program implementation, and they all had similar budgets. And through that evaluation, we found that care groups had double the behavior change of non-care group projects and had 53% greater under 5 mortality reduction. So this is not just a new model, it's a better model for behavior change. The nurturing care group model not only compares favorably with other models in terms of outcomes, but in terms of costs. Here are the costs per beneficiary for several of World Vision's core project models. Note that nurturing care groups are a fraction of the cost of several of our other models. Increasingly, we want to use low-cost models like this to achieve measurable results. Of course, this doesn't remove the need for our other life-saving WASH interventions, such as digging wells, but we need to assure that we're seeing behavior change at the household level as well if we want that work to bear the most fruit. So why do nurturing care groups work? Well, some of the reasons are rather obvious, but some we need to study. One reason is the coverage plan. Usually over 85% of all caregivers are reached every 2 weeks with behavior promotion messaging and activities with this model. And the caregivers who do not attend a meeting are reached through a follow-up home visit. Secondly, and I think this is one of the real keys, the caregivers themselves select or elect the nurturing care group volunteer who will promote behaviors with them. This makes it much more likely they'll be working with someone who they like, trust, emulate, and would welcome in their homes, all of which helps behavior change happen more easily. Third, the lesson plan format builds in some of our best science in behavior change. There are a lot of other reasons, but those are probably the top ones. I hope that you now have an idea of why we're so excited about this model for use in WASH and the sort of impact that it can have on the world's children. Thank you.